welcome back to my channel. Today we're discussing Obsessive Compulsive Disorder, commonly known as OCD. This is a mental health condition that affects millions of people worldwide, yet it is often misunderstood. If you or a loved one are struggling with obsessive thoughts or compulsive behaviors, or if you simply want to learn more about OCD, this video will provide you with essential information on symptoms, diagnosis, and management strategies. OCD is a chronic condition that can significantly impact a person's daily life. It is characterized by persistent unwanted thoughts, known as obsessions, and repetitive behaviors or mental acts, known as compulsions. These obsessions and compulsions can be distressing and time-consuming, interfering with work, relationships, and daily activities. While OCD can be challenging to live with, effective treatments are available that can help manage symptoms and improve quality of life. In this video, we'll explore the symptoms of OCD, how it is diagnosed, and the various treatment options available. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. OCD is defined by two main components, obsessions and compulsions. While some people experience both, others may have primarily obsessive thoughts or compulsive behaviors without clear obsessions. Obsessions are intrusive and distressing thoughts, images, or urges that repeatedly enter a person's mind. These thoughts are often irrational, but they cause significant anxiety. Some common obsessions include fears of contamination, such as excessive worry about germs or dirt. Many people with OCD also have fears of harming themselves or others, even though they have no intention of doing so. Obsessions can also involve a need for symmetry and order. A person with OCD may feel extreme distress if objects are not arranged in a certain way or if they perceive an imbalance in their environment. Some individuals experience intrusive, unwanted thoughts related to religious, sexual, or moral concerns, which can be deeply distressing. Compulsions are repetitive behaviors or mental rituals that a person feels compelled to perform to reduce anxiety caused by obsessions. These compulsions are often excessive and not realistically connected to the preventing the feared outcome. One of the most common compulsions is excessive hand washing or cleaning in response to fears of contamination. Some individuals with OCD engage in checking behaviors, such as repeatedly verifying that doors are locked, appliances are turned off, or that they haven't made a mistake. Counting, tapping, or repeating certain words or phrases are also common compulsions. These actions are often performed in a specific pattern or number of times to reduce anxiety. People with OCD may also engage in mental compulsions, such as silently praying, reviewing past events, or mentally neutralizing unwanted thoughts. OCD can range from mild to severe, and in some cases, compulsions can take up hours of a person's day, making it difficult to function. Many people with OCD recognize that their thoughts and behaviors are irrational, but they feel powerless to stop them. Others may struggle with insight and believe that their fears are justified. Avoidance is another feature of OCD. To prevent anxiety, individuals may avoid situations or objects that trigger their obsessions. For example, someone with contamination fears may avoid shaking hands, touching certain objects, or even leaving their home. The severity of OCD can fluctuate over time, with periods of increased stress often making symptoms worse. Without treatment, OCD can significantly impact a person's ability to work, maintain relationships, and participate in daily activities. Diagnosing OCD involves a comprehensive evaluation by your doctor or a mental health professional. Because OCD symptoms can sometimes resemble other mental health conditions, such as generalized anxiety disorder or obsessive compulsive personality disorder, a thorough assessment is necessary. A diagnosis of OCD is based on specific criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5. According to these criteria, a person must experience obsessions, compulsions, or both. These symptoms must be time-consuming, taking up at least an hour per day, and cause significant distress or interfere with daily functioning. During an evaluation, a provider will ask about the nature and frequency of obsessions and compulsions. They may explore how these thoughts and behaviors impact daily life and whether the individual tries to resist or control them. A key distinction in diagnosing OCD is the level of insight a person has into their symptoms. Some people recognize that their fears and rituals are excessive, while others may have limited insight and firmly believe that their fears are justified. OCD is sometimes misdiagnosed or overlooked, especially if the person does not openly discuss their symptoms due to embarrassment. Some individuals with OCD may only report feeling anxious or overwhelmed without describing their obsessions or compulsions in detail. This is why open and honest communication with a healthcare provider is essential for an accurate diagnosis. In some cases, OCD may be associated with other mental conditions, such as depression, anxiety disorders, or tic disorders. Your doctor will assess for any coexisting conditions to develop an effective treatment plan. While there is no specific medical test to diagnose OCD, a doctor may conduct a physical exam or order laboratory tests to rule out underlying medical conditions that could contribute to symptoms. However, the primary diagnosis is based on psychological evaluation and clinical history. Once a diagnosis is made, the next step is developing a personalized treatment plan to help manage symptoms and improve quality of life. OCD is a chronic condition, but with proper treatment, most people can experience significant symptom relief. Treatment typically involves a combination of therapy, medication, and self-help strategies. Cognitive behavioral therapy, or CBT, is one of the most effective treatments for OCD. A specific form of CBT, called exposure and response prevention, or ERP, is considered the gold standard. This therapy involves gradually exposing the individual to their fears while preventing compulsive behaviors. For example, a person with contamination fears might be asked to touch a doorknob and refrain from washing their hands immediately. Over time, repeated exposure to anxiety-provoking situations helps reduce fear and break the cycle of compulsions. ERP is highly effective, but it requires commitment and professional guidance to implement successfully. Medications are another important part of OCD treatment. Selective serotonin reuptake inhibitors, or SSRIs, such as fluoxetine, sertraline, and fluvoxamine, are commonly prescribed to help regulate serotonin levels in the brain. These medications can reduce the frequency and intensity of obsessions and compulsions. For individuals who do not respond well to SSRIs alone, higher doses or combination therapy with other medications, such as clomipramine or atypical antipsychotics, may be considered. Medication is most effective when combined with therapy, and it may take several weeks for noticeable improvements to occur. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, in severe cases of OCD that do not respond to standard treatments, additional options such as transcranial magnetic stimulation, deep brain stimulation, or intensive therapy programs may be considered. These treatments are usually reserved for individuals with treatment-resistant OCD. Lifestyle changes can also play a role in managing OCD symptoms. Regular exercise, a balanced diet, and sufficient sleep can help reduce overall anxiety levels. Mindfulness and relaxation techniques, such as meditation and deep breathing, can also help individuals manage stress and intrusive thoughts. Support from family and friends is crucial in managing OCD. It's important for loved ones to understand that OCD is not simply a matter of willpower or personal weakness. Encouraging treatment and providing a non-judgmental environment can help individuals feel supported in their recovery journey. Avoiding reassurance-seeking behaviors is another key aspect of managing OCD. Many individuals with OCD repeatedly ask for reassurance to relieve anxiety, but this can reinforce compulsive behaviors. Instead, loved ones can encourage the person to rely on therapy techniques to manage their anxiety. OCD is a challenging condition, but with the right treatment and support, many people can achieve significant symptom relief and lead fulfilling lives. Early diagnosis and intervention are key in preventing symptoms from worsening over time. If you or someone you know is suffering from OCD symptoms, don't hesitate to reach out for help. Thank you for watching. As always, take care of yourself and make the most of your day.